Hello, and welcome to this learning module on newborn jaundice. This presentation was created by Cornerstone Pediatrics. The information on this site is available to you solely for general information purposes. Information on this site is not intended to diagnose or treat any illness. You should talk to your healthcare provider about how information on this site applies to your health conditions. We'll answer the following questions. What is jaundice? How does it affect newborns? How can I help my newborn feel better? What do I need to look out for? When will my newborn feel better? Jaundice is a yellow-orange tint to your baby's skin and the whites of their eyes, which are called sclera. It is caused by high levels of bilirubin. It may be caused by low intake, which slows stools and allows more time to absorb bilirubin. Jaundice can cause a yellow color of the eyes or skin. You can check this by gently pushing on the tip of your baby's nose and seeing if there is a yellow color underneath. They may have drowsiness, poor feeding, darker urine, and paler stools. How can I help my newborn feel better? Increase their intake by offering formula every 2 to 3 hours or breast milk every 2 hours. If jaundice is mild, allow baby to sunbathe in indirect sun for 15 minutes 3 times a day in only a diaper, taking care to maintain normal body temperature. If jaundice is moderate or severe, the baby will need phototherapy, also called Billy lights, using special lights either at home or in the hospital. You can help by following the prescribed phototherapy instructions. You will need to call your medical provider if the jaundice is spreading from the face downward to the neck and chest, if the whites of the eyes or the sclera are becoming more yellow, if the baby is not feeding well for any reason, if there are less than 3 stools per day after 4 days of age, or if the baby appears more tired, has a fever, or appears more sick. Babies tend to start getting better after a few days, and jaundice usually resolves after a couple of weeks. Thank you for learning about newborn jaundice. For medical questions, please call your provider. If you are experiencing a medical emergency, please dial 911 immediately. Do not rely on this information as a substitute for professional medical advice. Thank you for learning with Cornerstone Pediatrics.